Hi everyone, and welcome to the School of Health Information Sciences Health Terminology Standards Seminar Series for June and July. My name is Linda Bird, and I'm one of the instructors for the Health Terminology Standards Certificate Program, and I'm here with Alejandro Lopez for today's seminar. Before we get started, let's begin with our territory acknowledgement. We acknowledge and respect the Lekwungen peoples on whose traditional territory the university stands, and the Songhees, Esquimalt and Wasanich peoples whose historical relationships with the land continues to this day. Just a reminder that this seminar series is delivered as part of the final course of our Certificate of Health Terminology Standards. The deadline for applying for the next intake is fast approaching on July the 15th, if you're interested in joining the next certificate program that starts in September. So today is the fourth seminar in our Health Terminology Standards seminar series. Last week we heard from Robert Hayward and Debbie Pinter from Alberta Health Services, and next week we're going to hear from Derek Ritz from the EC Group on computable care guidelines. And today's presentation is on SNOMED CT trends and latest developments. Please note that these sessions will be recorded and shared on the school's website, and please use the chat box to type in any questions that you have. Today, I am delighted to introduce a good friend of mine from SNOMED International, Alejandro Lopez. Alejandro is a family physician and medical informatics specialist who trained at Hospital Italiano in Buenos Aires, Argentina. For the last 20 years, Alejandro has collaborated with different digital health projects worldwide, contributed to international working groups on standards and interoperability, and consulted on implementing national digital health agencies. In 2019, when he was the National Director for eHealth in Argentina, he was in charge of designing and implementing the National Digital Health Strategy at the National Ministry of Health in Argentina. He was a member of the World Health Organization Digital Health Technical Advisory Group from 2019 to 2021, and he is now a Senior Implementation Support Specialist at SNOMED International. So with that, I will pass over to Alejandro for your presentation. Thank you so much, Alejandro.
Thank you, Linda. It's a pleasure to be here and to present this in this meeting. Thank you very much. Okay, so the idea today is to do a presentation, an update about SNOMED, just covering different aspects of SNOMED. It's just a short introduction. I know Linda gave a very detailed introduction to you already, so we do a very fast refresher, so we have all the same concepts. And then we will discuss a bit about what's the status of SNOMED today based on the past trends, some focus areas that SNOMED is developing, and some ideas about how you can discover more about SNOMED strategies, information, and documentation. So as a refresher, SNOMED, like you know, is the most comprehensive multilingual clinical terminology in the world. Yes, it's a comprehensive because it has a very wide range of content. Yes, it's used just for diagnosis, for symptoms. It's used for procedures that you do on the patient. It's used for vital signs. You can describe the organs, you can describe the agents that cause diseases like bacteria, virus, and other things. You can describe devices. So it's really, really wide. It's used in many different aspects or parts of the information model in electronic health records. Yes. And SNOMED is maintained by SNOMED International, that is a non-for-profit based in the UK. The goal of SNOMED International is to deliver editions of SNOMED CT, yes, the updated editions every month. It's owned and funded by the members, and the members are the country members. Yes, there are 48 countries today that are members of SNOMED International, and these countries fund the organization and also sit on the governance positions in the organization to define the priorities and how SNOMED works. SNOMED is governed by a GA, a General Assembly, and a management board. So I will open the meeting chat in case I have some problem with my audio, and you can just ping me there. In SNOMED, in each country is represented by a local organization that is called the National Release Center. Yes, and in Canada, for example, this role is played by Canada Health Info. Canada Health Info works with SNOMED International to deliver the Canadian edition of SNOMED CT and provide other supporting services to SNOMED users in Canada. So SNOMED is a terminology, it's a large terminology, it's full of content related to the medicine, and the key, the cornerstone of all SNOMED content is the idea of a concept. Yeah, a concept is an abstract thing. The concept is something that the physicians know, everyone that is involved in the healthcare process understands things about the healthcare area, right? So, for example, we know that a patient with pain in their chest with determined characteristics, it can be some angina, it can be some disease that is related. We have the clear idea of that disease. So SNOMED contains concepts, and those concepts are identified by an ID. I think this slides out of order. This is what confuses me. But well, SNOMED International has 48 members today, and this is a distribution around the world. In some countries, SNOMED doesn't have like an official participation of the government as a member country, but there are licensed organizations that use SNOMED in those countries. So this was out of order. So we have the SNOMED, the concepts, and the concepts are these clinical ideas, these knowledge, these things that the physicians, the nurses know about the health of the patients. But these concepts need human readable terms to be able to identify, to communicate, and to search and find them. And this human readable term I call descriptions. Yes, these descriptions are the terms that compose the terminology. SNOMED has around 360,000 concepts and has more than 1 million of descriptions. Yes, because there are more than one description associated with many concepts. There are two main types of description: the FSN, the fully specified name that you see there, that has a semantic tag. This one that says disorder, that tries to identify the category of the SNOMED concept, and then it has all the synonyms. So, for example, for myocardial infarction, a synonym can be cardiac infarction or heart attack. And also synonyms can be included in different languages, and this is how SNOMED is translated. The same concepts, the same clinical ideas have different labels, different terms. The terms are the descriptions. And we can see here two French descriptions, for example, yes, that are part of the descriptions available for this concept. Also, because SNOMED is an ontology, it's a big terminology with concepts related to each other, it has relationships, and the relationships is what it connects concepts with other concepts. So, for example, the myocardial infarction that we are looking is related to some group of concepts, to ischemic heart disease, myocardial necrosis, necrosis of anatomical site, and it's related with a relationship that is an ISA relationship. It's a kind of relationship. So the myocardial infarction is a ischemic heart disease, and these are different ways to group a concept in SNOMED. Yes? And this is, SNOMED has this characteristic to have multiple parents compared to other classifications and terminologies. And also, SNOMED not only has this hierarchy, these ISA relationships that communicate the parent and the child, it also has the attribute relationships. And in this case, we have the relationship to myocardial structure, for example, that this means that this is the finding site of the concept. Yes, each one of the properties of the concept, the meaning of the concept, is described with attributes. So in this case, the myocardial infarction has one of the attributes that is finding site myocardial structure, but another attribute is the associated morphology, which is an INFA. The morphology is an histological morphology, for example. So in this case, we can see how this concept is defined by the places where it's grouped in the hierarchy with all these parent concepts we see with the ISAs, but it's also defined by its attributes, which is defined inside and associated morphology. And this is like a very simple way to describe how the ontology works. If we go to another hierarchy, a different hierarchy, we can see, for example, that a concept like amoxicillin 500 oral tablets, because we say that SNOMED covers different domains, yes, and it also covers the domain of clinical drugs and generics. So amoxicillin 500 milligrams oral tablet the attributes are different because it's a different kind of concept, so it doesn't have a finite side, but has a presentation strength numerator, which is 500. It has a count of active base ingredients, which is only one because it has only one ingredient. And it has others like precise and the manufactured dose from something like that. These relationships also are interesting because they are not relationships from one concept to other concept, but are relationships that add numerical values, like the 500 and the 1. Yes. So the definitions of the concepts are expressed by these attributes that sometimes point to a different concept and sometimes are called concrete values and point to an actual value, like 500, for example. And using these attributes, you create the concept definitions. And this is the concept definition for myocardial infarction using the graphical standard in SNOMED. We can see the 4 parents with the ISAs, and we can see the attributes, the finding sign, and associated morphology. And there's a concept model behind it that is rather complex. And if we see the same for the amoxicillin 500 milligrams, we see that it's much more complex because it has all the details of the attributes of the strengths, numerators, denominators, the actual substance, the dose form, etc. Yes, so it's really interesting how each concept of SNOMED is defined using these attributes and these expressions. SNOMED has a machine-readable concept model, which is a set of rules that computers can read in order to help the authors and to help people who want to extract information from SNOMED to understand what are the rules to define meanings. Yes, which are the attributes I can use, what are the values for those attributes, and things like that. SNOMED also has computable language. It has these expressions that you can write to express a meaning, and also expressions that you can write to create like a constraint or a query. Yes, that we will see some of that later. Then it's really, really useful. SNOMED also has reference sets, which is an equivalent to FIRE value sets in the sense that these are subsets of concepts that are selected for a determined purpose. But some reference sets are not only a subset, but they add additional information to these subsets. Yes, and this additional information sometimes is used to define maps, for example, to define how SNOMED maps to ICD, and sometimes it's used to define languages, to say these descriptions can be used in this language with this acceptability, or something like that. And the engine that binds all this together is the description logic. Yes, so the description logic is a technique that is used to compute equivalency and compute subsumption in these complex terminologies. Yes? So every time you see SNOMED, actually you are seeing the result of a complex reasoning process based on something called description logic. Yes. Other features include the broad domain of coverage that we have already mentioned. SNOMED is version, like we said before, it's released each month now. We will see some of that later. And there is a robust versioning system. You can see all the changes. You can reconstruct all the versions of SNOMED very easily. Like no information is ever lost. Everything that is changed, you keep all the previous states and things like that. Also, SNOMED is designed to be international. Yes, it's designed to be applicable to different settings and to enable interoperability between different countries. But it also has localization mechanisms. Like we said before, that Canada releases the Canadian edition of SNOMED CT, and that's an important feature. When you use SNOMED, you can localize SNOMED to your language, we can add new concepts, you can add new definitions, you can add new ref sets, etc. So this is really a key of one of the benefits of adopting SNOMED. And in the past years, yes, the healthcare setting and the world has evolved a lot. Yes, we know that the healthcare costs are rising everywhere in the world. Every time it's more expensive to provide the same level of healthcare. Before, there are new technologies, there are new medications, people live more time. So really, this is something that impacts healthcare all around the world. As well as people age, they tend to have more complex periods of life that require more care. It's more complex. There are more comorbidities. Everything is delayed. So it's really taking care for older and older populations. It's really changing the landscape of medicine and complicating planning the delivery of care. This goes all the way with the evolution of chronic diseases. Yes, before there was a higher burden of acute infectious diseases, accidents, and we are working every day to reduce infectious diseases, reduce accidents. So the portion of the deaths that are related to chronic non-communicable diseases is growing each time, and taking care of chronic diseases is more difficult than acute diseases, require more longitudinal view over the patient and information related to the patient. And of course, new infectious diseases still appear, like COVID, yes? So we have outbreaks, and we need to have very special information and very accurate information and up to date in order to manage this pandemic. So we saw the cost of that during the COVID pandemic. So in this context, we see a lot of growth in the international membership, yes, because people are actually deciding to implement complex digital health strategies that collect clinical information, and they need standards to share information on different systems, and countries are adopting SNOMED solution in order to harmonize information between different systems and to provide advanced tools for the people that use the system, for implementers and decision support maintainers and things. Yes. So the number of memberships, the member countries is growing, like you see here, and the number of affiliates is growing as well. Yes. So we see there's a huge interest in implementing these terminologies. But also, not only the numbers are growing, but also the complexity of the systems. Yes, we have this maturity matrix that we use to evaluate how far the systems are implementing all the capabilities of SNOMED CT, from level 0 that's not using SNOMED CT yet to level 5, which is advanced use. Yes, and we see every day how different systems are progressing on this. First, maybe some systems are mapping to SNOMED, then some systems start to use SNOMED as a simple code system directly instead of mapping. Others start to take advantage of the hierarchies in order to customize terminology bindings and data input and analytics. Others go one step ahead and start using the semantic network to do queries, understanding, classifying, and things like that. And some of them are going all the way to take all the advantage of the description logic and MRCM and PCR. Yes. So we see a growth not only in the number of use, but also in the quality of the use of SNOMED. So SNOMED is growing each year in order to adapt to these needs, in order to continue being the best solution for countries to approach these challenges of interoperability. Yes. So what we will see now is some areas that SNOMED is focusing in order to provide the best tool for countries and organizations. So SNOMED is trying to improve the quality and the responsiveness of organization. So that's one area where we'll show you some initiatives related to that. SNOMED recognizes that we need international data sharing, and we need to work with other organizations, with other terminologies. So there are many initiatives that are related to that. And finally, SNOMED recognizes the importance of implementation. This is the first thing, implementation, the second, and the third, like the real estate, location. In SNOMED, there's implementation. Yes. Without implementation, all the benefits of SNOMED are not realized. So there are a lot of initiatives trying to take advantage of that. So we will go through these, and we will do some demos at the end of some of the demonstrators and initiatives related to that. So in equality and responsiveness, there are initiatives that are related to these areas, like increasing the semantic expressivity of SNOMED to express more meanings with more detail, improving the quality of SNOMED in general, making more frequent international releases, and flexibilize the delta generation. And delta generation is obtaining differences on the releases of SNOMED from one point in time to the other. So one of them, in the increasing semantic expressivity, in July 2019, the stated relationships were replaced by description logic accents. This is really technical, yes, but there was, in general, if you want to explain this change, and this is really a meaningful change for SNOMED, is that before, this meaning that we showed as relationship before was expressed Yes, and using that in a plain file has some limitations and some obstacles. Yes. And what SNOMED did in 2019 was to migrate to stop using the plain file to define this relationship, but start using the OWL axiom bracet file. And this is adopting a standard expression mechanism to define the meaning of the concepts. Yes. Previously, when we used the stated relationship file, we created an infer relationship file, and we were only capable of representing links between concepts, because relationships were relationships between A and B, with A as a source concept and B as a target concept. But this migration in 2019, 2020, allowed the SNOMED editor to start to represent other things that are these concrete values, like the numbers we showed before, the 500 milligrams, for example. This is something that was enabled recently. It was not possible to do before. And it was enabled in the context of this initiative to increase semantic expressivity and these new techniques. Yes. So now, before you have only the relationships that point to a different concept, like has unit of presentation, tablet. Yes. But now we have these numerical attributes like has presentation strength 500. Yes. And this is really meaningful for adding new things to SNOMED and being more accurate to represent the real meaning of concepts. Also, SNOMED is such a large terminology and has such a long history that started in 2002. And in 2002 was a merge of previous terminologies, like the LHS rate codes and SNOMED RT. So there is a lot of baggage coming from really maybe 20 or 30 years ago. Yes. So it's important to have a very proactive quality initiative that will try to find issues in the SNOMED content and fix the content that is necessary. So SNOMED has the quality improvement initiative that started in 2018. It uses automated expression temples and manual reviews to identify and fix modeling and naming inconsistencies. The original focus was clinical finding, but when that was a bit resolved, now has moved to other hierarchies like procedural, medications, and substances. Also try to be responsive and to fix problems very rapidly and to adapt to new requirements from countries. SNOMED moved from more frequent releases. SNOMED was released every 6 months until 2022. Yes, and after some testing, at the beginning of 2022, SNOMED started to be released once a month. So we have monthly releases now. Before it was 6 months, twice a year. And now we have 12 releases a year. And this is really interesting because it opens a lot of opportunities to be more dynamic in the way that SNOMED incorporates content. Yes, if SNOMED receives like a request from a country, a national member, those requests can be impacted and be available for the rest of the world very easily and much faster. This was especially highlighted with the need of adapting to changes in COVID. Yes, and the idea of releasing monthly provides a new flexibility for users that want to be up to date really fast, but also it doesn't impose any obligation because actually you can skip releases. If you already have a process in which you update SNOMED in your system every 6 months, you can wait and update again in 6 months without the need to update every month actually. So SNOMED it has different editions. Like we say, SNOMED International maintains the international edition. And this can be deployed in any system and you can work with international edition. But some countries, not all, but some countries create national editions. These national editions add new terms and maybe sometimes new languages, new ref sets, concepts for local diseases, endemic diseases, foods, medications, etc. These national editions can also be implemented in the system, and your system can either choose to use a national edition or an international edition. And usually that's mandated by your country interoperability framework. Yes, when you're developing a system in your country, you have rules around you that say, okay, we will all use the national edition. All in this case, we will all use the international one. Also, sometimes when you're implementing in a hospital, you want to add your own things in the hospital or in a healthcare organization like many hospitals. And you say, okay, SNOMED is fine, but I would like to add a few concepts. we say things in a different way. I would like to add a few terms. I want some subsets, some refs. I want to map to a local vocabulary, and I want to do all that as part of SNOMED. So you can create a local edition, and the local edition will depend from the national edition, and the national edition will depend from the international edition. There's a dependency link between them, yes, and this is really interesting. So when we are releasing now every month, like I said before, and you can decide which one you implement, yes, and you need to migrate every so often. You don't need to migrate in each month, yes. So your system can keep migrating, skipping some of the editions. When you have a national edition, the national edition will have a dependency from a fixed international edition. So if your country, like Canada or like Argentina or Netherlands, releases twice a year a national edition, the country will say which are the editions that are used. For example, Canada has one edition based in January and one edition based in July. So the February edition is actually not linked to any national edition until July. Yes. So when you are in a country, you can either use this or this. You don't use the ones in the middle because you have whatever is available by the country. Yes. So in order to be able to implement this very rapidly and you to skip things and say, okay, we'll skip one release and update every 2 releases, every 6 releases, SNOMED had to create a service that is delta generated service that allows you to say, I'm using this edition of SNOMED and I want to go to this edition of SNOMED. And maybe there's 1, 2, or 3 editions in the middle. But this system will provide you with the difference, will provide you with a package that you can add to your terminology server. And you can update the terminology server to the latest edition, adding only what you need, without the need to download the whole SNOMED, scratch what you have, and start from blank. Yes. So in this case, a delta generator is something that facilitates this dynamicity of using different editions of SNOMED-CT. So now we go to a section of working for international data sharing. And we have some content here related to the IPS terminology, related to the drug model, and the community content platform. Like you know, the international patient summary is an international resource maintained by different standards organizations, by ISO, HL7, SNOMED. They all work together in order to produce an international resource that is in a structured format in which you can share information about the patient. Yes, it's designed for cross-border. That's why it's called international. It's designed for cross-border interoperability or cross-border exchange. It can easily be used also for inter-systems exchange. Yes, so the international patient summary is used all around the world, and it's used sometimes in countries that don't have a national SNOMED license. Yes, so the SNOMED has created the international patient summary terminology. Is that it's like a subset of the SNOMED terminology that instead of having 360,000 concepts, has 15,000 concepts, something like that, 15. And these 15,000 concepts are completely free of access, are released with a Creative Commons license, so are completely free around the world. And they have the same structure and the same hierarchies and capabilities as the standard international release or national edition. Yes, so it has all the capabilities of SNOMED, but restricted to a small set of concepts. And this set of concepts is based on different subsets created from clinical experience, mostly the core subset by the National Library of Medicine that collects information from different sources. So it's a very practical subset. It's small, completely free. So this enables the creation of an international data sharing structure in which anyone can get SNOMED content and they can understand the content in the context of their national SNOMED editions or these free resources like the International Patient Summary. There's a browser for the IPS, and you can see like the small terminology of IPS. also, SNOMED, because it's used for international data sharing, needs to be aligned with the needs of the country to represent special information. And one of the information that is very distinct between countries is the drug information, the medications information. Yes, each country has their own processes for approving medications. It has their own national medication dictionaries. And SNOMED has all the capability to represent the attributes of a drug, like the dose form, the strength, like we saw before. But those things vary from country to country. Yes, so SNOMED has a set of clinical drugs without brands that are mostly common around the world, that are the most used clinical drugs around the world. And when a country incorporates that, they need to start creating the full model for representing clinical drugs. So this is the common drug model. And the common drug model includes like group or categories like medicinal products and medicinal product forms. But this model also includes the clinical drugs, what are the unbranded drugs with strengths. And countries can create their own real clinical drugs. And real clinical drugs have a brand. Yes, and you can associate the brand with the manufacturer, and you can have packages to say this medication with this manufacturer, with this ingredient, with this strengths, comes in this form and this amount and in this container. Yes, and this model is a model of classes in which a concept that is in each one of these boxes has different relationships and express a different meaning. And this is designed in order to support prescription, dispensation, and analytics over clinical trials. Yes. This is this common drug model is basically using attributes and values to define all the necessary attributes. Also, for international data sharing, recently SNOMED has signed a new agreement with LOINC. Yes, LOINC and Russian Trif is the organization that maintains LOINC. It's a vocabulary mostly used for laboratory information. It's for observations in general, but it's very much used in the laboratory realm and the orderables realm. And it's something that is many SNOMED users also use LOINC, and there have been many historical approaches to see how these things can be matched with each other. And there's a new initiative now, really serious, that started last year, that what it does is to try to represent the whole LOINC as a SNOMED extension. It's, like we say, there can be a national extension or a local extension. There will be a LOINC extension. And that LOINC extension will contain all the LOINC concepts, but the meanings of the LOINC concept will be expressed as a SNOMED content. So if we go to, do you see the browser here, right? The LOINC browser. If we see some of these, like glucose. This is only looking at LOINC concepts, yes? And you can see how, for example, the substance concentration of glucose in cord blood at point in time. Yes, this is a concept and is described by these attributes as a component glucose property, substance concentration property, scale, time aspect, grid site, all this information that is contained in LOINC. And slowly this information is being moved into SNOMED format, and it will be released as part of a SNOMED extension. Yes. So this is really significant in that sense. And also SNOMED is open to create other extensions for other particular purposes. And this is the community content platform. The community content platform is something that allows organizations that have created small extensions for a purpose to publish those and to make them available to other users. Yes, so there are examples of that work in Cancer Synoptic. There's a common French translation that different countries that want to translate to French are sharing content. The COVID vaccines, there's a genomics common model. So there's really interesting areas to work on how to have a community maintain content in SNOMED. And now going to implementation, yes, which is the thing that is most interesting for Linda and me, is that there are several initiatives that try to facilitate implementations for users. Yes, and we're gonna go through some of them. We'll go one by one. There's a value platform. Yes, the SNOMED has worked a lot on creating a value proposition toolkit. It's a website that you can go if you go there, and that tries to describe the benefits of SNOMED for different stakeholders. It's common that if you, maybe it is less and less common, but for new countries and for new organizations that don't use SNOMED, sometimes you need to make the justification about why I'm using SNOMED, why we will go through the process of incorporating a new vocabulary different to what we have. Is it worth to do it? What's the benefit? And this site is very interesting because it helps you understand the different aspects of the benefits. It has some metrics. It's really, really well organized in order to support the creation of these reasoning processes that support the adoption of a standard. So it's a very nice site to go and check around to see all that. And also, SNOMED has an implementation support portal that is published now on implementation.snomed.org. This portal has a library of guidelines, of content, of book, of PDFs that you can see and explore and work with that. And it also has all the links to the training content. Yes, SNOMED International has an online education site and e-learning site, and all the training is linked from there. Some of the training is free, especially if you live in a member country, and some of the training may require a fee. The regional support portal also offers the possibility to do workshops with implementation. So we usually plan calls with people who are going through the process of adopting SNOMED CT in a region or in a tool, and we listen to them. We try to give ideas to compare with other countries and have like these workshops to advise on the best strategy to adopt SNOMED. Also, you will find in the site information about tooling, different tooling that is available to support implementations, and this is really interesting. We will see some of the tooling in the next slide. There are the user groups. There's a SNOMED user group and a drug model user group. So there are different user groups that are available for people to contribute, to collaborate, to ask questions. And there's also a help desk. You can email info@snomed.org, and we will receive those questions. Those questions are triaged and sent to the proper expert in the organization to try to help you. But it's completely possible to have personalized help in that email. Yes. And like we say, that tools are one important component of supporting implementations. And one of the examples is mapping. Yes, many implementations require mapping of existing codes to SNOMED. Yes. In some cases, for example, if you have a list of radiology studies, radiology procedures that you do in your hospital, sometimes it's better to map the list that you already have than starting from SNOMED and allowing the doctor to order anything that is in SNOMED, because obviously some of the radiology procedures in SNOMED may not be performed in your organization. So sometimes it's very useful, if you have that, to start from a local list and then to map to SNOMED, obtaining the codes of SNOMED that are most accurately linked to the terms in that list, in that local vocabulary. Yes. So SNOMED created a tool for that. And that tool is called Snap to SNOMED. Yes, Snap to SNOMED is a very interesting tool that's completely free of use. Yes, that allows you to create a project and start mapping. Let me show you just a brief glimpse of this. You can register yourself and get access and start mapping. I think Linda commented that some of you are already doing this, which is really exciting. Because you don't need to have like a complex authoring tools or things like that. It's a tool that allows you to create a new map. When you have a new map, it allows you to, let's use one of these. It allows you to load your own codes. For example, this is Drugman, which is an organization that has drug interactions and things like that. And you can unload this list of codes that comes from DrugBank, and you can do some automatic mapping first, and then you can review the map, or you can assign blank maps to people that should author the map, and then that will be reviewed. So there's a review process in that, and then you can export the results. But after the process, you can see things like this, like the DB001, which is the pyrudine in DrugBank. It's actually equivalent to the pyrudine substance in SNOMED, 386955005. Yes, so this is a map, and this is a tool that is used to manage this information, to create and maintain these maps. Yes, so we are all invited to try SNAP to SNOMED and to use it for your local implementations. And also, one important part of implementation is to being able to query codes in the patient records, being able to use queries in SNOMED. And SNOMED has a language for that. This is SNOMED expression constraint language. Yes, that can be used for terminology bindings, for clinical decision support. And here we have an example of how an expression works. In this case, it's looking for all types of clinical findings that are part of the international patient summary and have an associated morphology that is a kind of infarct, or is associated with myocardial infarction. Yes, this is really readable. It's a way to create a query in a way that you can share, you can edit, you can control the quality, and you can try. If you want to try a bit about this, you can go to the browser. Yes, so if you go to the browser, we have the expression constraint queries section here. If you load the ECL builder, you can say something like AHMA, for example, and you can click OK, and these are all the different types of AHMA. If you execute that, you have 105 concepts. Yes, but you can add something like that asthmas that are also I've been complicated myself here trying to find another parent for asthma. Let's see there's an asthma concept that is also an infectious disease using different. It's a combination of the two of them. So if I execute this, I found 0 because there are no. Yes. But you can define these queries as much as you want. But you can also start adding refinements and say, of all the asthma, I will only want the ones that let's add a refinement that have some specific attribute, like let's say pathologic process, allergic process, some asthma that are related to allergy. Yes, and you can execute this, and you find 36. So not all the cases of asthma are related to an allergic process, but some of them are. Yes, this is how you can create these queries and test these queries using the browser in the builder. So this is always evolving, yes, because this is so important. This language that allows you to create this expression is important to restrict or validate the information the doctor or the nurse or the clinician writes, but also it's important to extract that information and to link to early services. So one of the challenges that were there before is that even when you implement SNOMED, you only use the active concepts, but because SNOMED changes every month, maybe something that you coded a year ago now is inactive. You use the concept that now is replaced by a different concept. And previously, because these ECL queries only capture active content, it was very difficult to access all the information recorded with concepts that are no longer active. So as part of this continuous evolution of SNOMED, the ECL specification was modified, was enhanced to add new features. In this case are the history supplements. Yes, and the history supplements is a command that allows you to find concepts that are not only active, but also that are inactive, but linked to the active concepts. So if you go and see that again, let's say all the asthma concepts, yes, these are all the active asthma concepts. Yes. But if I add the plus, if I add the plus history command, I have more. Previously it was 136, and now I have 181. If I go to see the ones in the bottom, some of them are red, and these red ones are inactive concepts that you may have used in your clinical records if you coded these terms previously. But these concepts are now linked to the active concepts. And so they are still relevant if you want to do a query to get all the asthmatic patients, for example. Any of these will do, and also any of these that are inactive. And you have some flexibility. Yes, you can do history mean, which is very, very strict, and only the ones that are closely related to the active ones are included. But you can have also history max, which is very relaxed, and you find a lot of them. Yes, so you have some power to define the level of accuracy and the link of the inactive concepts and the active concepts. So this is one of the examples of how the specifications are continuously evolving in order to have new features. Yes. Other examples of these query enhancements to the query language is to have member filters, and this, for example, allows you to say, give me all the concepts in which the map target is J459 in the ICD-10 ref set. So this is looking into a ref set and matching into the attributes of the ref set. So this way allows you to use query not only to get hierarchies, but also to get concepts based on mappings, or concepts that have certain definition status or effective times, or descriptions in particular languages and things like that. So this is constantly evolving in order to have new and more flexible tools to support implementations. So now we are around the version 2.1 of the ECL language. Also, this is very important for us when you want to implement that you have all the possible or the best possible capabilities in order to use SNOMED-CT. Yes, SNOMED-CT releases as a package that are plain files that can be imported into a relational database, and you can see the concept, relationships, descriptions, the ref sets. You see all the information there. But when you want to start working and playing with SNOMED more seriously, you actually need to have support for these. You need to have support for these languages that allows you to restrict the information you make available to the doctor, so it only works in one specific domain, or to extract information and then match with the clinical records. So in order to do that, the best way to do that is not to code all that logic yourself, but to use a ready-made terminology server. Yes. So when you use a terminology server, what you do is you get this SNOMED package, you put it on the server, and then you use the server through an API. Yes, and that server has already the capability of understanding all the languages, the ECL, the expression constraint languages, expression languages, and everything. So one of the goals of using terminology server was to use a standard for that. And like HL7 file provides a standard for accessing terminology content, which is the terminology model that contains the code systems, the value sets, and the concept maps. So when terminology servers use a standard API, like a Fire API, the good thing is that you can swap them. You can use an open source terminology server, and then you can swap to a commercial one, or you can swap to a third one, because it's like a commodity. Once they all use the same API, you can start trying different terminology servers and decide which one you want to use in the long term. SNOMED created Snowstorm. Snowstorm is the open source terminology server provided and maintained by SNOMED International. Yes, and Snowstorm is very interesting because it's really simple. It has a process to install it, but there's a guide that guides you step by step to install SNOMED. It's a good way to get started using terminology services because it's completely free and open. Yes, and now Snowstorm supports multiple code systems, so you can load SNOMED, but you can also load ICD, or load ICPC, or load LOINC, or load CPT. And then you can use the API to query ICD and SNOMED in the same way, because they are both code systems, both use expansions, both use value sets, etc. So it's like a normalization of access to different terminologies. Yes. And if you go to the Snowstorm side, this is the GitHub side, and this is the user interface demo. So let me show you that. Snowstorm is completely free. Yes, so you have it here to download. There's a releases section. It's released 8.2.2.2 was released yesterday, so it's really active in development. Yes, and you can see all the different capabilities here, all the guides for installation, everything is here. And using the Snowstorm, you can create things like this. Let's look at the user interface example. This is like a sample clinical record that each one of these fields is linked to SNOMED using a terminology server in the background. In this case, it's using a Snowstorm, for example. So if I put something diagnosis like asthma, I see asthma, asthenia, and things like that. If I write append, I get appendicitis. Yes, and this is because the options in this field are constrained to a specific part of SNOMED. Yes, if I click on the eye, I see they are constrained to clinical findings. And this is why I can search for any clinical finding. But if I go to procedure and type the same thing, I get appendectomy, which is a procedure. And this is because it's linked to procedures. So each one of these fields is linked to a different part of SNOMED. The process of linking these fields in the information model to the SNOMED terminology is called terminology binding. And the way to express the binding, to express the constraint about which part of SNOMED is valid for the field, is to use these ECLs, the expression constraint language expressions. Yes, and we can do that this way. And because we are using Fire API, which is standard, I can switch to Onto Server. And Onto Server is a commercial terminology server from CSIRO in Australia. It's used by many countries as the national terminology server. When you do that, and you search, and you get the same thing. So it's the same interface, and we are just changing the terminology server. Completely different terminology servers, one is paid, one is free, but they both use the same API. They both use the same way to connect and to be integrated into clinical systems. And that API is the Fire API. That's the code system Fire API. Other of the interesting advances that came recently was the post-coordination tool. Yes, post-coordination is a complex thing that it was very difficult to explain before. Still is difficult to explain and understand, but SNOMED, because SNOMED has definitions with attributes and relationships, it's very easy to add a new concept in your extension, provide all the definitions, and the concept will be organized in the hierarchy in the correct place if you enter the right set of attributes. And you can do that when you create an extension. That's called pre-coordination, because you create concepts and you release the concepts. All the attributes are created before the release of the concept and before making the terminology available for a user. When you are a user, you receive the terminology and it's full of pre-coordinated content that has been defined by the authors of the terminology. But there's a way in which you can express new meanings on the fly without the need to go through the need to release a new edition of SNOMED. And the way to do that is to use post-coordination. We can see an example of that in this demo tool. Post-coordination needs to be supported by the terminology server, yes, and it needs to be supported from the UI. Well, for example, if you look for asthma, like we always do, yes, you want to say severe asthma, maybe you don't have a concept like that in SNOMED. Maybe you do, maybe you don't, but maybe you can add the severity clicking here or here. Yes, and when you do that and you save, this will create this expression. This expression is the severity, severe, found inside airway structure. This is the definition of what severe asthma is. And then if you look to all the different kinds of asthma, you get all the normal kinds of asthma, but at the end, you also get the different post-coordinated terms that you have used. Yes. So when you do that, when you click on save, you get this and you get a new expression that you can save in your system. Instead of using an ID, you can use this. But this has a meaning, and this is organized in the hierarchy, and this comes back in the results. The same post-coordination can be used to express meanings, composing different attributes in a form. For example, if you have a wrist fracture, you can say which part of the wrist, like distal radius, which morphology, it's an open fracture, and which displacement, let's say posterior displacement, and you save. Yes, and this is an open cold fracture. There's an equivalent concept. What we created here exists in SNOMED, and it's called open cold fracture. Yes, and this is the definition. And this combination is presented to the user. If you use the location and you save, yes, this is not replacing the thing, but it's not there. It's not a concept in SNOMED. When you look for a location, you only get the post-coordinated expression. So you can create new meanings on the fly. Your system needs to be capable of storing this as an ID. For example, this is the ID, the combination of codes, or you need to assign new IDs to the expressions in order to do that. So there's a process that you need to go to take full advantage of post-coordinated expression. But previously, it was not possible to do that. So let's say I remove the dislocation here. So this tool allows you to actually use post-coordination and still use ECL and find the post-coordinated expression as the result of the ECL. Yes, because they are stored in the terminology server in an expression repository. This is a bit complex, but maybe sometime in the future you will come to a place where you would say, maybe I need post-coordination here. And I think it's possible because I listened to a class a long time ago. So this is more to give you that kind of context information. Other thing that SNOMED is working on is to create a simple extension toolkit. Yes, we talked about how sometimes you create an extension in the country and sometimes you want to create an extension in an organization. But the tooling around creating and maintaining extensions is really challenging. So the goal of this project, that actually Linda was the one that started this project, was to make it really simple for people to create SNOMED extensions based on simple files. Yes, you can edit extension using Excel, using the Snap to SNOMED, the tool we showed you, some other simple rough set editors, and you can combine all the output of these tools, and you can put everything in this simplex toolkit, and you can get an extension of SNOMED that you can load into a terminology server, and you can make it available for the EHR and the clinical users. So this is something that is now working on for an internal use, but we are aiming to release that later in the year. It will be really interesting. Other things that we are doing is to use to create demonstration projects. Yes, so this is the implementation demonstrator. We have sandbox and we have this and allergies. For example, this is the allergy group in SNOMED. The allergy CLG is a clinical group in SNOMED with allergy specialists work on defining how SNOMED is used in this particular context. Yes, they review everything that is around in order to understand how allergies could be recorded with SNOMED, what are the best practice, what's the advice. And their advice is to use FIRE. They are basing everything on the FIRE model of allergy intolerant representation, yes, with the allergy intolerant resource and observation resource. So this guide explains how to use SNOMED with those resources. And this side tries to give you a practical example of how it looks like. Let me close this. So in this case, let's say this is following the recommendations of the guide. On the left, we have a form that maybe is a more clinical form. And on the right, we have the output of a file resource. So let's say we have allergy to aspirin. Yes, so I type ASPI and I get allergy to aspirin. And this is because the binding here is looking for all the propensity to adverse effect or the propensity to adverse reactions. Yes? So that's why this is restricted. And when you select that, the system automatically understands that the type is an hypersensitivity position, that the substance is aspirin, that the substance category is a medication. Yes. We can say that this is active or inactive. We can say, okay, this is confirmed, and it's really high risk. And it's high risk because the manifestation was an angioedema, yes, of lip. Yes, and the severity was severe, and the exposure route was oral route. Yes, and this way you can define it. Everything I have selected in this form is available here in the, you see the oral route, the angioedema, sleep, the aspirin. Everything is available in the allergy resource. Yes, the allergy resource is defined by FHIR, and this is the FHIR implementation guide for that resource. So this is how we help implementers to understand how to bring something that is a text guide into practice, to say this is how it will look like if you use this information to represent allergies in your system. Yes, so this is why I always try to couple a guide with a demonstrator of the same purpose. But also the guide outsource, when they see it live for the first time, they learn new things, and maybe they change the guide to adapt, they find gaps in the guide. It's really interesting to be the first ones to try to implement this. And the other ones we did was the terminology binding sandbox. And this is a sandbox that allows you to play around with SNOMED content and create like a SNOMED form, like a UI based on SNOMED CT. This is an example of how you can create a form, but let's clear that and start from scratch. You can say we can add the title like my new form, and you can say that the type of this is title. Yes, you can add this, and you have my new form there. And then you can add a new binding that says, let's say this reason for encounter. And you can say the type of this is an autocomplete box. And the ECL expression, you can click here on ECL builder, and you can say descendants of income finding, for example, and you can, okay. And the other note, enter the and this is how I create a field, and the ECL expression is the terminology line. This tries to communicate. This is how you link an information model with someone. Yes, and when you do that, you can type here as, and you get as. Yes, and then you can say, let's add a new binding, and the new binding maybe it's say smoker, and you can say it's options. It's two options, and the ECL expression we can search for smoker, no refinement. No, I'm trying to remove this. Smoker. And then we can add an or smoker, non-smoker, self, and or self, ex-smoke, something like that. Yeah, okay. And I add the binding, and I have this. So I do smoker, ex-smoker, and non-smoker. And you create these fields like this. And if you open the data panel, you see how everything you select gets this SNOMED code on the right. Yes, and this is the smoker field. Right here, append like we did before. Open, you get appendicitis. And if we add a new binding like procedure, and it's type, it's an autocomplete, and this here expression. Zero. That takes a bit of time to load. We can restrict the hierarchy to a different thing. Trust me, it's loading on the backup there. Descendant of procedures, okay. You can back here the same thing. You put up and take them. And you can change the order of this if you want to change it, or something like that. So, and you can download this. If you want to download this, you will download the JSON file, and then you can upload and so basically, this is used to train people on terminology binding, to explain them how they can create an information model that is linked to SNOMED in this way, how they use restrictions, how use different data types and field types and things like that. So let's go back to the presentation. Other one we created in this is the ICD maps demonstrator. This is interesting because it's this is the one. Maps. SNOMED, as you know, it works in tandem with ICD-10 and now with ICD-11. We have a preview map for ICD-11 already. It doesn't replace completely the old classifications because SNOMED is used for data entry, and classifications like ICD are used to report for statistics, for demography, for international comparison and things like that. So if you have something like asthma, for example, we have an ICD map which is to J459. That comes from the maps that SNOMED provides. Here's asthma unspecified in the ICD browser. Some of them are more complex. For example, if you have pneumonia with AIDS, the ICD map maps to two codes because you have one code for AIDS and one code for pneumonia. Yes, and these are the rules. You have two groups with the same priority and all the same are selected. Some of them, like neoplasm of kidney, are interesting because they map to something more general, like neoplasm of uncertain or unknown behaviors urinary organs. You are losing information there, but that's fine. Yes, and this is how it's called. Some of them, like photogenic epilepsy, also map to that. ICD-11 provides some benefits because it classifies the photogenic epilepsy as a reflex epilepsy. So it's more similar to this true concept, but it's still a group. Yes? A neoplasm of the right kidney, when you go to ICD-11, it actually has it's called post-coordination ICD-11, but it's completely different and much simpler. It has a concatenation of codes to express that this neoplasm of uncertain behavior of urinary organs occurs in the right kidney, and this is represented by this thing. And this is how it's represented in the map. But if you go to ICD-10, there are a few concepts in SNOMED that requires more information in order to be properly classified in ICD-10. And one of them is infertile. And infertile depends on the gender. If it's a female, it's 97, and if it's a male, it's N46. So if we choose male and you refresh the map, you can see that the green dot changed because now the proper map is N46, male infertility. And if you have some missing information, you actually cannot map the source, so you cannot assign a code in ICD-10. So let's go back to female. And the last example is some of the maps are related to age, for example. So the map from SNOMED to SNOMED to ICD-10, the concept is osteomalacia due to vitamin D deficiency. If it's lower than 18 years, it's E55. It's older than 65, it's M8319. And otherwise, it's M8389. So this is why we have 83, 89 now, because we have 35 years old. But if we change that to 11 years old and refresh the map, we get the E55. And if we change that to 87 years old and refresh the map, we get the .19. This is how maps are used in the SNOMED and how they affect. You need sometimes more clinical information in order to resolve maps from SNOMED to electrophysiology. And you can see the free codes here. And the last one to close, I think that this is, many people are talking about that, is that we can use SNOMED with AI, for example. There are many people trying to say how I can use SNOMED with ChatGPT and the new large language models. If you ask a SNOMED code to ChatGPT, previously it invented the code just from scratch. You get a code, but it's completely invented and you can't find the code in the browser. But now it's saying, depending on the version of ChatGPT you use, sometimes it says, I cannot access the list of codes, so I don't know how to use SNOMED code. And it avoids trying to invent the code. But we have tried, and we've been playing around with different things, trying to see how the future will look like in these things. So in this case, this is an example using a ChatGPT plugin. Yes, we developed a plugin that you can put in ChatGPT. If you have a paid version of ChatGPT, you can enable the plugin store. And if you are allowed as plugin developer, you have a feature to play with a developer plugin, yes? And using the developer plugin, you can say to ChatGPT something like, code this clinical note with SNOMED. An 80-year-old woman was admitted with pancytopenia, 5 weeks early, nausea, vomiting, diarrhea. And when you create the plugin, what you do is you explain ChatGPT that SNOMED is in the browser, and you can go to the browser and search for the codes yourself. So each time you see one of these boxes that says unverified, the plugin is unverified because it's not published yet, is using the browser actually to search for terms and obtain the codes. So the response is really much more meaningful from ChatGPT now, because it says that it can be coded in this way: pancytopenia, nausea, diarrhea, chills, and these are really valid codes of SNOMED CT. It says no fever, and he didn't find the concept for no fever, so it can be represented in the clinical context. He didn't find the code for pelvic masses, bilateral pelvic masses. However, there is a code for pelvic mass. So this is really interesting how the ancient figured out how to use the singular form to identify a match. Also for schistocytis, anisocytosis, and low platelet count. So this is an example. This is a URL of the plugin that you could install yourself if you have a paid version of ChatGPT Plus, and you have applied for the permission to develop plugins. You can use, but it's a lot of restrictions. But there's another side that also does a few demonstrations on this and can show you. We are only 15 minutes away, so maybe we can ask a few questions and we can go back to this if you think it's interesting. But we have this site in which, if you have a developer key for OpenAI, so if you register in OpenAI, it's a paid license as well, but you can get a developer key. And you can use this site in order to do similar things like NLP and maybe generate terms for SNOMED, translations, explanation of ECL. There are different techniques that you can apply there. But this one, for example, for the same text that we saw before, is identifying the clinical terms. You see the clinical terms here. Look in the browser. Fever now is translated to fever, known absent, to a post-coordinated expression that expresses the absence. And one interesting thing is this: parsing this text costed like 1/3 of a cent. Yes, so it's getting really cheap. If you have a large volume of documents, probably it would be still expensive, but it's rather, for testing or for playing around, it's really, really affordable. So these are examples of how this new AI trend and how these large language models can be used with SNOMED with the proper guidance. Yes, if you use them out of the box with SNOMED, they won't work as you expect. But if you use it as a part of a process in which the language model does the extraction of the critical terms, the simplification, and then you go through a step of actually searching into a SNOMED terminology server to find the codes, you get actually very good results using that. So this is all the content. We always invite you to go to the SNOMED site and find more information about courses, tooling, the user groups, and everything. We have the SNOMED Expo in October in Atlanta, 26th to 27th of October in Atlanta. We have the annual SNOMED Expo that is really interesting to apply and to participate if you want to work on this. So now is the time for questions.
Thank you so much, Alejandro.